When taking our pulse and monitoring our heart rhythm, what should we be taking note of?
We should be aware of our heart rhythm. Know your pulse to know your heart rhythm. Many of us know our heart rate, but by simple 3 fingers on your wrist and getting to know the rhythm of your heart, is it too fast, too slow, is it irregular? Visit knowyourpulse.org to find out how to know your pulse to know your heart rhythm.
Excellent. So tell us, how do you know if you have atrial Afib?
So for some people, there are symptoms for Afib. It may be your heart is pounding out of your chest like the beating of drums. It may be that it feels like a bag of worms wriggling around, palpitations, exhaustion, fatigue climbing stairs. For others, there are no symptoms. For some, they're permanently in Afib. For others, it comes and goes. So it's important, by being pulse aware, heart rhythm aware, we become aware if we have an irregular heart rhythm, which is possibly Afib.
And what are the risks associated with Afib?
The greatest risk associated with Afib is Afib-related stroke, because when our hearts are not beating in rhythm, then the blood doesn't flow freely and a clot may form. This clot may break away and travel up to the brain to cause an Afib-related stroke.
And tell us about what tools patients and physicians can use to detect Afib.
So once we've experiencing symptoms and we know our pulse and we are aware that we have an irregular rhythm, we should go to our healthcare professional. Now, if we're in permanent Afib, it's quite simple for your doctor to diagnose atrial fibrillation. A 12-lead EKG with the electrodes, and it will diagnose almost immediately. However, for those that are not permanently in Afib, it may come and go, or they may have no symptoms, so they're not aware of any of this. They need more continuous monitoring. The latest technology is a simple patch, and it literally sticks on just below your collarbone, and it monitors your heart rhythm. It is a 24/7 EKG for up to 14 days. Now, whilst wearing this patch, you can still go to the gym, you can exercise, you can shower, you can do whatever you normally do, and it will continue to record your heart rhythm, even when you're asleep. So if you have silent Afib and it occurs whilst you're sleeping or whilst you're doing anything and you're not aware of it, the Zeo iRhythm patch will be aware and it will record it to help your healthcare professional give you the correct diagnosis.
Excellent. And if someone is diagnosed with Afib, what are their options?
So once you're diagnosed, you should discuss with your clinician your options. First and foremost, to be anticoagulated, so that when your heart's quivering, a clot might form which breaks off and goes on to cause a stroke. An anticoagulation therapy helps reduce the risk of a clot forming, therefore reduces the risk of a stroke. You also need to discuss treatment, because anticoagulation does not treat Afib. That treatment may be medication, it may be surgery, it may be ablation. You need to discuss what is best for you, so that therefore not only are you being anticoagulated to reduce your risk of stroke, but you're also being treated to better manage your Afib, atrial fibrillation.
And where can people go for more information?
For more information on generally atrial fibrillation, go to knowyourpulse.org. For more information on the Zeo iRhythm patch, go to irhythmtech.com.
Thank you for joining us today.
Thank you.